It depends.
It does depend. And it depends on the relationship you have with that provider. The other day we had an attending and I was like, can we stop the PPI? There's no need for stress ulcer prophylaxis in this patient. And she said, what do you have against PPIs?
A lot.
So I listed off, increased risk of C. diff, hypomagnesemia, GI infections, CKD,
pneumonia,
Alzheimer's. And she's like, okay. She's like, can we go with an H2 blocker? I'm worried about this patient. So we compromise there. You have to have evidence to back up why you're saying what you're saying. Mm-hmm. Our providers trust us, so they tend to take our recommendations. But when they don't, it's always good to find out why. A lot of times there might be something I'm missing. Mm-hmm. So they say, well, I don't want to do that in this patient because, so I learned from that.
Mm-hmm. Communication is really important in life. So like Dr. Bell just said, finding out what their reason for not wanting to do it, sometimes you miss something, or sometimes there's something in that patient's history you didn't know. But the flip side, if you can come with actual data, that primary literature that says, well, this will improve your patient outcome, usually they'll change their mind if you say this is going to help the patient. There are times where they won't, that sometimes people get stuck in their ways. And so it depends. You have to pick your battles. So if it's not going to change the patient's mortality or length of stay, but there just might be a better drug, not worth fighting.
Right, and that's what I was going to say if Dr. Barber didn't say it, is you have to know when are you going to put your foot down and fight. If there is a benefit in clinical outcomes on the patient, or less collateral damage, pending how much that is, that's where you might actually take that step and say, no, really, this needs to happen, and you might put up more of a fight about trying to get it to change. And by putting up a fight, it's more of a, would you like me to bring you evidence for this? I can bring you evidence for your side and my side, and we could talk about this. And it's more along that lines versus just kind of saying, okay, I just thought I'd ask, and backing off. And you'll learn as you go through rotation what starts to matter to you personally, based on the evidence that you know about, and then learn from your provider, and they're going to learn from you. So as long as you keep an open mind that both of you are just trying to do what's best for the patient, that's what matters.